I want us to discuss dry cough as our topic for today's program. A dry cough or unproductive cough does not produce mucus. A tickling sensation in the throat can make you have a dry cough. Dry coughs can come on after a cold or flu if you have COVID-19. Other conditions like GERD. GERD is a digestive disorder that affects the rings of your muscle between your esophagus and your stomach. Heart failure and lung cancer can cause chronic dry coughs. You may also have chest tightness with a dry cough. What is dry cough? A dry cough does not produce mucus because there is no mucus blocking the lungs or airways. Nothing comes out when you cough. This lack of mucus makes it an unproductive cough. You see, sometimes we think that all coughs are cough, but there's a difference between dry cough and wet cough. Sometimes when you're having dry cough, each time you cough out, maybe you are feeling something blocking your lungs, you are trying to cough it out, but at the process of coughing you cannot see anything coming out. So this one is dry cough, when you are trying to bring out the mucus inside your throat, blocking your throat or your lungs. What is the difference between a dry cough and a wet? We have dry cough and we have wet cough. So now we are asking, what is the difference between this dry cough and a wet cough? A cough is your body's way of clearing the lungs and airways of irritants so you can breathe better. So when you have an illness that affects your respiratory system, you may cough up mucus. This is a wet cough. You understand the difference now? So the difference now is very clear. Healthcare providers consider a wet cough to be productive because it clears mucus from the lungs and airways. If too much mucus build up in the lungs, you may become short of breath and develop other problems. So the difference is very clear now. Dry cough is unproductive, while wet cough is productive. Dry cough has no mucus on the lungs or airways, while wet cough has mucus on the lungs and airways. So when you have a dry cough, nothing comes up. This unproductive cough does not open up the lungs or air passages. What are the symptoms of a dry cough? Your throat can become irritated and dried. You may develop a sore throat. All these are symptoms of dry cough. When you have an unproductive dry cough, you essentially cough up air. A dry cough that is very vigorous or lasts longer than 3 weeks, which is a chronic cough, can strain your lungs or your chest muscles. You may develop chest pain with the cough. Any cough that lasts longer or that lasts up to 3 weeks is better and is advisable you see your doctor, because you may develop chest pain with the cough. Most people have a feeling of chest tightness with a dry cough. You may feel a squeezing sensation in the chest or pressure, like there's a weight on your chest. You should see your healthcare provider if you have concerns about a cough. There is no sickness that is okay for the health. So each time you are having all these little challenge of health problems, it's advisable you see the doctor or a healthcare provider. Don't just take it as a normal stuff or a normal A chronic dry cough may be a symptom of lung cancer, heart failure, tuberculosis, sleep apnea, and chronic obstructive pulmonary disease. Care and treatment. How can I treat a dry cough and tight chest? Most dry coughs clears up when you treat the underlying causes. Over the counter, which is the OTC cough medicines, are not usually that helpful, and children younger than 4 years of age should not take any cough medicine because of the risks for serious side effects. Don't just go to the chemist and buy anyhow drugs for your children because it may affect them. Some home remedies that can help. Drink plenty of liquid to stay hydrated. Try hot tea or water with honey and lemon to soothe irritated airways. Suck on cough drops or hard candies. Sucking on a lozenge, which is cough drop, promotes saliva production that soothes the throat. But don't give cough drops or hard candies to children under 4. Take a spoonful of honey. Study shows that honey stops cough as well as most OTC cough medicine does. So, not prescription medicine. It refers to medicine you buy without prescription. Another home remedies are: your healthcare provider can recommend the right amount of honey based on the ill person's age. Never give honey to a child under 1 year of age. In babies, honey can cause botulism. What is this botulism? It's a rare but serious illness caused by a toxin that attacks the body nerves and cause difficulty breathing, muscles paralysis, and even death. Use a humidifier. A humidifier is a machine that puts moisture into the air. Humidifier makes it easier to breathe for person with certain condition. A cold mist humidifier puts moisture into the air. This extra moisture soothes nasal passage and sore throat and ease dry coughs. You can also get more moisture by taking a steaming shower or hot bath. How can I prevent dry cough and chest tightness? These steps may lower your chance of having a dry cough. Avoid irritants and allergens like chemicals, mold, and frankincense. Practice good hygiene and wash hands frequently to prevent respiratory diseases. Quit smoking and avoid second-hand smoke. When should I call the doctor? You should call your doctor or your healthcare provider when you start experiencing these symptoms like having fatigue, fever and chills, sudden or unexplainable chest pain, difficulty in breathing, then coughing up blood. It's advisable you see your doctor. Many conditions can cause a dry cough. Often, an irritating dry cough will go away when you identify and treat the underlying condition. You can use home remedies to soothe dry coughs that develop after a respiratory illness like a cold. Coughing can inflame lungs and air passages, leading to chest tightness. These symptoms should improve when the cough clears up. Rarely, a chronic dry cough indicates a more serious health problems. You should see your healthcare provider anytime you have a lingering or unexplainable cough. Some causes of cough are also cold, flu, and catarrh. This can also cause cough. Each time we experience these coughs, don't just see it as a normal thing. It is advisable you see a healthcare provider. This brings us to the end of today's program.